Hello everybody. Today we'll be talking something about whooping cough. As I can see nowadays, a few cases of whooping cough in UK. So I thought we just discuss it to increase the awareness. I will divide it into two sessions because if I give too much information in one session, that can be difficult for everybody. So I will be telling today some information about whooping cough. So whooping cough, also called pertussis, it is very contagious bacterial infection of lungs and airway, and it causes repeated coughing bout that can last for 2 to 3 months or more, and can make babies and young children particularly very ill. Whooping cough spread as droplet of the coughs and sneezes of someone with the infection. So symptoms. Symptoms, his first symptoms are similar to those of the cold, such as runny nose, red watery eyes, sore throat, slightly raised temperature. So intense coughing bout that starts a week later. And the bout usually lasts few minutes at a time and tends to be more common at night. Coughing usually brings thick mucus and may sometimes cause vomiting because in between cough your child may gasp for breathing, and this may cause a whoop sound, although not everybody will have this. The strain of coughing can cause the face to become red and maybe sometimes slight bleeding under the skin and in the eyes. Young child can sometimes briefly turn blue, that is called cyanosis, if they have trouble in breathing. This often looks worse than it is, and their breathing should start again quickly. In very young babies, cough may not be particularly noticeable, but there may be brief period where they stop breathing. The bouts will eventually start to become less severe and less frequent over time, but it may take few months before it stops completely. Now, who are particularly at risk of whooping cough? It can affect any age group, um, including babies, young children. Babies under 6 months are particularly increased risk of complication of whooping cough. Older children, adult, less serious, but still it is a bit unpleasant for them. People who have had whooping cough before, you are not immune if you have had it before, although it can be less severe second time. People vaccinated against whooping cough, protection of whooping cough tends to wear off after a few years. You can get whooping cough if you come into close contact with someone with the infection. A person with whooping cough infectious for about 6 days after they were infected, when they just had a cold-like symptom until 3 weeks after the cough bout starts. And now antibiotic treatment can reduce the length of time, sometime in infectious. Now, when to get medical advice? So in NHS area, you have to go to A&E or phone 999 if your child have significant breathing difficulties such as long period of breathlessness, choking, shallow breathing, periods where breathing stops, and they become dusky and blue. Develop signs of serious complications such as fits like seizure or pneumonia. Now you can go to your general practitioner or 111 of NHS area if you have symptoms of whooping cough and cough is more than 3 weeks, and cough have a cough that particularly severe or getting worse. So I think this is a nutshell about some initial information. Next time we'll go in detail about the treatment, complication, what are the things we have to do, what about a bit of vaccination. Hope this information helps you and increase the awareness about whooping cough. Thank you for listening. We'll come with the second session next week. Bye for today.